Everybody's here.
Uh,
Full house. All right. Let me just do this.
Oh, I didn't see everybody. I didn't do the gallery thing. Now I'm seeing
Right.
everybody. Hi, Sean.
Hi, Sean.
Hi,
Welcome,
how are you?
Narcissa. Hi, Bob.
Hi, Sean. Hi, Bob.
Oh,
I'm going to mute myself. My 2-year-old's having a bath and making a lot of noise.
That's fun.
You can wait one more minute see if Kevin comes on board, and then we'll get started.
So I have information regarding Kevin's attendance.
Oh,
He sent me an email that he won't be able to make it, and
Okay.
he would like to share his thoughts on the Pleasant Street Center. I have his statement here, and if
Okay.
you'd like me to read it, I can read it.
okay. So
Recording
maybe,
in progress.
maybe after we hear from Kevin and Elise, and we open it up for discussion, we could start with Kevin's statement, and then I'll can chime in, if that's okay. So why don't when I call the meeting to order, the agenda is really focused tonight primarily on the Council of Aging request for a mask mandate at the Pleasant Street Center. And we have representatives from the Council of Aging, Kevin Miller and Elise Warren, to talk to us about this request. We put an agenda item for other COVID issues in case there were any that people wanted to raise. We're not planning any votes in that section, but just a discussion. And of course, we have our usual meeting a week from Thursday. January 6th is our next regularly scheduled meeting. And then we have a public comment, and there are, I understand from Ade, there's 3 individuals who would like to make comments, and we'll adjourn. So without further ado, I don't know, I guess I'll turn it over to Kevin perhaps, or Elise.
okay, sure.
Sure.
Well, I guess first off, I'd really like to thank you very much for convening so quickly on this request that I'm passing on from the Council on Aging. It's been a roller coaster at the Pleasant Street Center, and I'm equally concerned for the staff as well as the patrons at the Pleasant Street Center. When we opened up in June, we really didn't know what to expect, who was going to come back to the center, but we were very pleasantly surprised with all the people that returned, and they need the socialization as much as we can offer. We wish we could offer more, but we've eased into what we have offered as for programming, done as much social distancing as possible. I think you all are aware that back a little over a month ago, we did have a staff member test positive. So the center was closed for a week. When we came back, I think mask wearing was better, but that only took about a week for it to wear off. And then Omicron really picked up. And again, we just want to keep everyone safe. The Council on Aging on the 13th recommended that I request the mandate, and I fully support it. And whatever information I can provide to you, please let me know. I think Lorraine Lupi, we showed It's a Wonderful Life last Thursday, and we had 16 people register. We had a nice movie theater set up. We had 16 card tables and nice chairs, all socially distanced. Unfortunately, we only had, I think, about 8 people show up. So I think people were scared away, And then when Lorraine walked in, saw somebody without a mask, I think her letter was shared in the package, and she just didn't feel comfortable, so she left. So again, I support the Council on Aging's request, and I invite Elise to share anything that she might have.
So I echo Kevin's statements. Everybody was excited for us to reopen in June, and it was nice when it was nice out and the windows can be open. And then back in September, we brought back the games, and we've got at least 4 people sitting at a card table, 2 by 2. Most are not great about wearing their masks. They feel that they're vaccinated and they shouldn't have to. But with the Omicron picking up and case numbers going up, I mean, there's 21 cases in the queue today, just today, because Christine worked yesterday, so it was cleared out. So 21 today that's high. It's a lot. And the socialization is so important. We lost a lot of people declined. So if we can make them as safe as possible by making sure that they're wearing a mask, I think that would be the best and easiest solution for everybody.
And just if I can add, regarding the games, last week we asked the question, which activities are we having that we cannot socially distance? And the games were right in front of us. Probably have between 12 and 16 people in a room, just sitting at a 4x4 coffee table. So even if they are wearing masks, they're not socially distanced. So we will probably, again, looking to your guidance, hold off on doing those activities for a while, mask or no mask.
One of the other pieces when I talked to the other workers at the center was, should we be allowing the snacks and water, obviously for exercising? They need to be able to have access to hydrate themselves. But as Kevin said, our games are on hold, but bingo typically would be buying snacks. They're at a little bit bigger of a table, but just something else we'd like a little bit more guidance on, whether we should continue to move forward with that or hold off until things kind of settle back down.
Okay, well, thank you. So why don't we open the conversation, and maybe Ade, if you want to just read Kevin Sexton's statement, just so we get that on the record. Ade.
Right. So the Kevin's statement states, and I quote, "I fully support the request from Kevin Bumler to have the Board of Health vote in favor of a mask mandate at the Pleasant Street Center."
Well, that's extensive. Okay. Okay. Any other comments from board members, thoughts?
Questions, if I may.
Yep.
Do you have a sense, or do you have numbers in terms of vaccination rates and booster rates? No?
We were told when we first reopened, we couldn't ask. I would say a good majority of them probably are, but we're not 100% sure. I ran a report from Maven just for December, and there's been 477 cases. Of those, 273 have been vaccinated. So we're looking at a little bit more than half are breakthrough cases.
And you can't ask vaccination status?
We were told we couldn't.
Does anybody know why that would be?
Maybe it's considered a personal medical information that.
Well, they were asking it.
Just to be clear, this is vaccination rates of patrons.
Right.
That's right.
So I have been a patron to other venues and had to produce a vaccination card, proof of vaccination.
Yeah.
So why
I
can we not?
Yeah,
ask that?
That's
I
been our
agree.
legal advice for quite some time.
Interesting. Rick, if I may, I agree with Paula. I would be interested in if, maybe revisiting that advice, because I think that we're well within our rights of asking the question, and then people are within their rights of not answering as well if we're not tying any activity to it. But I'd be interested in knowing sort of the rationale for why we're not asking,
Yeah, me too.
or why we can't ask. Sorry, to phrase it better. Yeah.
Maybe that's something we can follow up on.
Yeah.
In terms of what a day, in terms of that statement. It is, that aside, it is the fact that if you look on the state vaccination data, for Reading over the age of 60 or 65, the vaccination rates are pretty high.
Yeah.
And I think they're 90+% or 85+%. That
Does that
doesn't mean
include-
that people who go to the Pleasant Street Center are that, but just in terms of the residents.
And does that include boosters, or is that?
Right.
I don't know about that.
Right.
It doesn't
don't-
include boosters.
And that's
I don't think
important to know.
Yeah.
Sorry, Elise.
Sorry, Carrie, go ahead.
I was just going to say that's important to know. I was just I was looking up some information, and the vaccine effectiveness with 2 doses right now, you're talking about 35%. If we get up to boosted, then you've got 75%. So that's a really important piece of information. And I just didn't have time to dig myself to see where we were on that.
Okay. Any other comments specifically around the mask mandate? I would say, myself, I think it would be highly advisable to have a mandate. I think it makes sense. This is the vulnerable population. They're in close contact. You can talk about a lot of other interventions outside of the Pleasant Street Center. But if we're going to have it anywhere, I think it should be here.
Sorry, Paula.
No, just that I agree.
Yep. I agree as well. I want to make sure we give Jerry time to speak too. Sorry, I didn't mean to jump over you there, but I think particularly given that circumstances haven't changed, our rates of transmission are higher in the first couple of days before you're symptomatic. So there's that risk. And given the very high contagion rate for Omicron, we're talking about, specifically with the Pleasant Street Center, we're talking about a population that likely have comorbidities that put them at greater risk, regardless of vaccination status. Even if boosted, someone with the number of comorbidities is still at risk. I did read Ms. Lupe's note and was moved by her observation about her particular circumstances. And I think that given to the circumstances that that our healthcare system is currently experiencing, it's very concerning, so concerning that I think this is it's an imperative that we implement this requirement.
Jerry, did you have a comment?
I was just going to say, I think Kevin actually stated very well my thoughts on this. So I support the mask mandate.
So unless let me just, before we get to that, Elise, you had mentioned about any advice we might have around situations where there's snacking, like at a bingo game. I think it's hard to, if there's an exercise program and you want to provide water, it's hard to say you shouldn't be providing water. I think that's very reasonable. But I think in terms of the snacking, it does require the mask to come down. They're sitting at tables that are not 6 feet apart. And it's a nicety, but it's not absolutely critical. I mean, frankly, I would suggest, not providing the snacks in that kind of setting. It just is not critical. But water for an exercise group, I think, is reasonable.
Agree.
Thank you. We were torn because that's what, this population likes what they've had, and this is what we've always had. And if they can go across the street and, sit with their friends, we've all been very torn. Like, yeah, it's just a very hard situation for us to be in, but we are all, I think, on the same page that if we don't have to, we don't really want to.
So I would make a motion that the Board of Health mandate that masks be worn at the Pleasant Street Center. And we probably should consider putting some date at which we can revisit it in the future. Paula, did you have a comment?
Yeah, I just wanted to clarify that the people who have who are here to have to say something about masks, to make sure that they're not addressing the specific Pleasant Street area or versus mask mandates in general.
Good point. So I see two members of the public, Narcissa and Rebecca. Were your comments directed around the Pleasant Street Center or some other issues or more generally? If
general, from my perspective.
General from your perspective. And Rebecca?
General mask mandate.
Okay. I think, one suggestion in terms of a sort of end date might be, perhaps our March meeting. That would be in 60 days, and we could reassess. It doesn't seem likely to me that things are going to be a whole lot better before March 3rd. And at least there will be a touch point where we can kind of bring that onto the agenda. Okay, so do I have a second for a motion to mandate the wearing of masks at the Pleasant Street Center to be revisited on March 3rd at our board meeting then?
I would second that.
Okay. Roll call, Carrie?
Yes.
Paula?
Yes.
Rick? Yes. Okay. So that decision is made. And I wanted to move on to the next agenda item, which there may not be. We kind of put that on because obviously we're all concerned about how things are evolving with the current surge, and whether there were any immediate comments or discussion that needed to happen prior to our routinely scheduled board meeting, which is on January 6th, a week from Thursday. So I don't know, Bob, yes.
Thanks, Rick. I should just update the board on town hall. We believe we're still under your purview in terms of any mandates or any public access / behavior. But 2 weeks ago, we met with all the town department heads here at town hall and discussed sort of pre-vacation, pre-holiday planning. And although not requiring a mask per se, we did strongly encourage that all employees at town hall wear a mask when anywhere except at their desk at a safe distance from folks. And people are complying very well, and they were anyways. I also requested that certain functions, specifically payroll and technology, make sure that colleagues are not working in close proximity to each other. And I asked that as many employees that could work remotely would do so, and to stagger work shifts and work schedules. and that would last through mid-January when we'd revisit it, just trying to get us past the holiday period. So I just thought I'd share that with the board, and Day was very helpful in the discussion.
Thank you. Other thoughts? Day, was there a booster clinic today? Did I see that in your
Yes.
comment? Yes. Do we have any other clinics scheduled in the next few weeks?
We are working on a townwide booster clinic for the residents of Reading. Today's clinic was focused on first responders. We had 22 participants. We gave out 18 doses of Moderna and 4 doses of Pfizer.
Good. That's great. Because I've been hearing, a lot of concerns that the usual way of getting your booster through CVS and Walgreens and so forth has been difficult. And so, and also the state, which, earlier this year really took control of the vaccination clinics, are now asking local towns and municipalities to supplement. And so I think that's something that we ought to be doing, trying to make it as accessible as possible. And so I think the more clinics we have, general clinics we have, the better. Because it's apparently, from what I hear, not easy getting those appointments in the retail pharmacies.
Yep.
Yes, Paula. You're on mute. Yep.
A lot of it would be helpful to do it as soon as he can, because a lot of kids that are home from college are some of them are being required to have them before they go back.
Right.
So that would be really helpful. And then again, having difficulty finding appointments.
Correct. I will update the board on times and dates that we can have it. I sent a request to Lisa. She's the owner of Vaccinate RX, and she should be getting back anytime soon.
Carrie?
Can I just ask, are we, I'm interested in the availability of pediatric clinics as well. To me, I know we talked about our last meeting that there was not a lot of, there was not a lot of demand, and that we didn't have a high rate of vaccination as well. And there was some discussion about what was the barrier. Was it education? Was it availability? Was it interest? I just remember being a mom with kids that age, and that for me the issue was scheduling for anything. It's just how do you manage to fit it in? So I'm interested in pediatric clinics, and specifically, how might we schedule something to make it convenient for families? Does it have to be just PD? Can it be PD and parents to get some people boosted at the same time as they get their kids done? So just to expand the list a little a day.
Absolutely.
Yeah. I mean, having those, being able to get a vaccination at school is just so convenient. But I have appreciated the fact that when I look at the vaccination rates for ages 5 and above in the town, they have been going up. I think initially they were like 20% or 25%. We were worried like people not vaccinating their children, but I think now we're seeing them climb to getting closer to where the adult population is, which is encouraging, but still better access would make it better.
Yeah.
Paula?
Just some of the parents that I've been speaking to is the initial hesitation. Has this really been tested out well enough with kids? Are they going to grow 30 years or whatever? But there's that initial hesitation, just like when the vaccination was introduced in the beginning. But that is, as more and more people are saying this, they've reacted with almost no symptoms, most of the kids, that it's now taking off, and there's less hesitation.
Yes, Schwang?
Hi, I just want to add, the school will have their next COVID clinic on January the 7th.
Is that, and that's at multiple schools or a single location?
It's probably the single location. They had multiple clinics in that location.
And kill 'em.
there is,
Kill 'em.
yeah, and there is a link for registration.
Okay. Great. I think unless, what we might do is, since we have two public comments, maybe we should go ahead and hear those and then see if there's any wrap-up conversation around any COVID issues that we want to talk about, and kind of go from there. So I'm not sure who wants to go first. Narcissa, why don't you go ahead?
Sure. I'm
Welcome.
new to, what's that?
Welcome.
Thank you. I'm new to these type of sessions, to the Board of Health, but have decided to become involved since recent goings on in a few towns in Massachusetts, and I want to do everything on my part to prevent it from happening in Reading. What I'm referring to specifically is vaccine requirement cards or identification for getting into facilities that serve everybody, are supposed to be serving everybody, but all of a sudden there's requests for discrimination. So I just want, I guess, have my ear on this, not just passports, but also mask mandates. I'm opposed to for a place unless the business owner decides that they want to discriminate or they want to mask up their patrons. That's up to them. So I don't know necessarily how to keep visibility of that, so that if that's something that were ever on the table for discussion, I would hope that it was well known, because I'm sure business owners would want to attend. So I guess I'm really asking for recommendations there.
And so let me make sure I understand what you're saying. You're saying that you're talking about vaccine mandates, or in terms of businesses, or
Try to say, show us your papers. So you can't get in here without, show us your papers, or you can't come in, which is what Boston's doing.
Right.
And is appalling.
Right.
And I don't want to see that. So that's what I mean by that. And I just would want to be aware if that was ever on the agenda. And
that has, at least in our previous board meetings, we've not discussed vaccine mandates or passports in Reading. And I know that Boston, maybe Cambridge, perhaps, have that, but it's not something that is, certainly not widespread across the Commonwealth. And
no,
so you could, it's out there, right? I know, but at this point, there's no mandate around that, and there hasn't been any discussion about going there. Rebecca, I think, had wanted to talk about mask mandates, which there has been discussion about, and there are a lot more communities doing that than this vaccine mandate. So, Rebecca, you wrote a very nice email, but maybe you want to, read that to us and give us your comments.
Yes, what I'm going to say is slightly different, because I have to give you a disclaimer that the opinions I'm about to express are my own. I actually work for the state. I'm an epidemiologist. So my name is Rebecca Lieberman, 50 Pratt Street, and I urge you to implement a mask requirement indoors in Reading. mandating masks at the senior center, which you just did, is an important step, and I'm glad you did that. But don't seniors need to be protected in everywhere else they go, as well as other vulnerable populations, including children too young to be vaccinated, immunocompromised individuals, or those with other health conditions, and particularly relevant to what I do for a living is those who are pregnant. There's evidence of increased risk of preterm birth and stillbirth with COVID in pregnancy. And also, you should know that the state recently recommended requiring masks indoors everywhere. The other statistics, because the issue of hospitals being overwhelmed came up. I just read this morning a 28% increase in pediatric hospitalizations. A lot of those are children who were either too young to be vaccinated or haven't received boosters yet or the full complement of vaccination. And at this time when our healthcare providers are absolutely overwhelmed, I mean, you don't have people unable to be treated for heart attack because the ICU is full. I'm happy to provide additional information, references, but I'm really concerned. We need to keep our residents safe, and a mask mandate is the best way in which to do it, in my opinion. It's proven to work.
Well, thank you. Thank you for that feedback. We've had discussions about that a couple times, and we've deferred on a decision. And I know that, you know, personally, I've struggled with the pros and cons of both, and you know, I think, you know, it definitely warrants more discussion. I'm not sure where that background noise is coming from, but if people can mute. There we go. And so, you know, I think that, I mean, my own personal, and we'll sort of fold this into the COVID-related discussions. My own, I strongly believe masks work, and I wish that DPH would have recommended a mandate across the Commonwealth. I mean, what is difficult, you know, I mean, if we lived in a small town in Kansas, 50 miles from the nearest town, you know, masking in the town is pretty self-contained. All the activities are in the town. I look at the map from MAPC around cities and towns that have mask mandates rather. And there's a number. Interestingly enough, none of the towns or cities contiguous with Reading have that mandate. And so, you know, I struggle a little bit back and forth about it's a good thing to do, and maybe we should just sort of think about that very seriously and move in that direction. On the other hand, you know, I think that you know, we're not an island. You know, I think a lot of businesses do have some mitigation measures in place. They've put up plexiglass. You know, they have 6 feet when you're standing in line at the cashier and so forth. So there are some things going on. There haven't been the strict, you know, caps on how many people can be in the store. We're not doing that. And when I look at when I look at our data, most of the cases are household contacts. Now, it could be the virus is picked up at a store, and they bring home and they give it to the 4 people in the household. But it's mostly household contact. So, you know, I think we need to have a more robust discussion about this, particularly since, the case rates are climbing. The wastewater data doesn't look good over the next few weeks in terms of increased number of cases. I think there's also an issue when we think about this around enforcement. We have a day in Schwann. We really have a very limited health department. And if you're going to mandate, you would want to be able to have the resources to enforce it. When I go to businesses around town, I would say there's probably, 50% of people wear a mask and 50% don't. So that's not that great, So I'd like to just open it up to hear what other board members, Aday, Schwang, anybody have any thoughts about this particular issue. We didn't have it on the agenda to vote, and by the open meeting law, we do need to do that, but we can certainly have a discussion. So Rebecca just sent a note, which, why is it that the library has a mask mandate? Frankly, any business, any public entity or business could, within their four walls, mandate that a mask be worn or they won't service you. And so the library has the ability to do that as well. I wish a lot more businesses in Reading, frankly, did that. But I think what we're talking about is across the board mandate, which takes away that control by those individual enterprises. Carrie, I'm sure you have an opinion here.
Wow. Yes, I do. Yes. So I have been having this conversation, talking about this. One of the questions, Rick, that you raised about enforcement, that one kind of has hung me up. But I'm not sure that enforcement. Yes, I'm conscious of the possible impact on our staff. I know that the complaints, when we had mask requirements in, the complaints, skyrocketed. And I'm very conscious of that. However, I'm not sure in this instance that our ability to follow up on our ability or inability to follow up on each complaint warrants not putting a requirement in place. And I'll be honest and say that I kind of started off in that place. I started off with, people were asking me, and I was like, well, it's really difficult to put something in place that you can't enforce. And as I've sat with this issue and stewed and done my research and the like, I have shifted off of it. And and the reasons why, we're kind of balancing all of these factors. And the reasons that are compelling to me are, again, the high degree of contagion, the fact that it's contagious early before anyone is symptomatic, the lack of availability of testing, and hopefully that doesn't continue. But right now, people are begging. I have my sister had somebody drive to her house at 10 o'clock at night to get a test because it was a mom of a 3-month-old, and she was terrified that she had been exposed, and she couldn't find a test anywhere. There's we're seeing it on Facebook. It's there was tests in CVS 2 hours ago. So, that's a to me, that's a real factor right now. And I hope that one will improve, but for the foreseeable future, I know that it's tricky. I also know that for treatment purposes, there's a lot of folks interested in the monoclonal antibodies that are available, and that's great. But of the three, only one of them is effective for Omicron. So, and that one is in short supply. So again, we're talking about some constraining factors that make it feel to me like it would be appropriate to consider requiring masks. I think the BioBot data, like you said, BioBot does not look good. And I think, we're going to see what happens now. We'll get our 2, 3, 4 week bump from Christmas and New Year's. I think there's going to be a lot of it floating around. And for those reasons, I want us to consider it. And I also will note, so let's see, the Mass Medical Society, MAPC, and the Mass Health and Hospital Association have all called for a indoor mask requirement across the state. There's a lot of people wishing, like you, Rick, and like me, that the governor would implement something. But sometimes communities have to lead, and we have to build the critical mass so that then the state says, okay, now it makes sense. So that's where I'm sitting with it right now, is that I really do feel like it's a protective factor that, in the absence of some of these other protections that we would have available, I think that protective factor of masking is important, and I'd like us to consider it and have a vote on it.
Paula, what are your thoughts?
I'm on board with you as well. The other thing is, again, Carrie always likes to say, education is such a key piece to this. And with this Omicron especially, there is evidence that the rapid tests are negative for Omicron. Only the PCR is positive. So people are getting themselves tested and thinking they're clear, and they're not. And that is further spreading it.
It is interesting that, another point to be made here is that, this board strongly advised the use of masks in public indoor places, did not mandate it. And actually, we did send out to, I think, food establishments and businesses a poster that says strongly advised, put this on your front door. But as I think I mentioned at a previous board meeting, a lot of establishments don't have that poster up front, number one. But also, I think when you talk about education, there is something educational about a mandate. I think people pay more attention to it, even though it may not be enforceable. There's a sort of weight there. So I think that's also something to consider. I wonder if maybe Bob, can I ask about the select board? I haven't seen any discussion at the select board meetings about this issue in the past month or two. Do you have any sense of that from that?
No, Rick, there hasn't been any discussion. Members have different sort of risk appetites. And early in the fall, there was a clear division between those that would attend in person and those that would not. That's largely fallen by the wayside, maybe partly because of the need to meet with a new town manager in person. But we're getting, better attendance. But one thing perhaps the board could think about for your next meeting, aside from a town-wide mandate, is to discuss and possibly decide whether volunteer meetings should go fully remote for a period of time. I can send you some information in advance, but I think that is probably, as a practical matter, where more people are gathering or potentially could gather that wouldn't normally come into buildings.
It's helpful. Dave, do you have any thoughts about this?
Well, I would like to share some factual information, and the board can make a decision based on the information I'm about to share. So this is going to be about individual mask policies at 8 municipalities, and then data regarding the 14-day average daily incidence rate and positive case counts within the past 2 weeks. So the 8 municipalities are not Reading, Wakefield, Stoneham, Linfield, Winchester, Burlington, Reading, Woburn. Matter of fact, 9, including Wilmington. So in Wilmington, masks are required in municipal buildings. In Not Reading, masks required in municipal buildings. Wakefield, no mask policy. Stoneham, no mask policy. In Linfield, masks are required in municipal buildings. In Winchester, masks are required in all indoor public spaces. All right, so let's put an asterisk on Winchester. Again, in Winchester, masks are required in all indoor public spaces. In Burlington, they have a recommendation for mask wearing. In Reading, we have a recommendation as well. In Woburn, masks required for only unvaccinated people in municipal buildings. Okay, let's put an asterisk on Woburn as well. Masks required for only unvaccinated people in municipal buildings. Now, I just read the mask policies. Now I would like to talk about the 14-day average daily incident rate. So let me see how I can tie that together to make it less complicated. So Wilmington has a mask mandate in the municipal buildings. Their 14-day average daily incident rate is 78.8 per 100,000 residents. And their positive case count in the past 2 weeks, they have 270 active cases. In Not Reading, masks are required in municipal buildings. Their 14-day average daily incident rate is 97.3 per 100,000 residents. Positive case count in the past 2 weeks, 227. In Wakefield, no mask policy at all. The 14-day average daily incident rate is 63 per 100,000 residents. And their positive case count in the past 2 weeks, 239. Stoneham, no mask policy at all. Their 14-day average daily incident rate is 67.7 per 100,000 residents. And positive case count in the past 2 weeks, 211. Linfield, masks are required in municipal buildings. 14-day average daily incident rate, 76 per 100,000 residents. Positive case count in the past 2 weeks, 123. Winchester, masks required in all indoor public spaces, including municipal buildings. Their 14-day average daily incident rate is 38.8 per 100,000 residents. And their positive case count in the past 2 weeks, 121. Burlington, they have a recommendation like we do. Their 14-day average daily incident rate is 58.3 per 100,000 residents. And their positive case count in the past 2 weeks, 227. Reading, we have a recommendation. Our 14-day average daily incident rate is 55 per 100,000 residents. And our positive case count in the past 2 weeks, 214. And last but not the least, Woburn. Masks required for unvaccinated people entering municipal buildings. 14-day average daily incident rate is 61.4 per 100,000 residents. And the positive case count in the past 2 weeks, 357. So, in summary, Woburn has the highest positive case count for 2 weeks. And their mask policy is, a requirement for masks for unvaccinated individuals to put on masks in municipal buildings. On the flip side, Winchester, their mask policy is, putting on masks in all indoor public spaces. Their 14-day average daily incident rate, which is the lowest, is at 38.8. And their positive case count in the past 2 weeks, which is the lowest, is at 121. So that's the data. It's up to the board to make a decision based on the data.
When I've looked at similarly these numbers in the past, and one of the things that is a variable that is hard to control for is the socioeconomic educational level of some of the communities. Because when I look at much more affluent communities, they seem to have lower rates. And conversely, we all have heard about, communities that have lower socioeconomic residents, and they have much higher rates. And there's a lot that goes into it, crowding, education, language issues. I mean, there's a whole bunch of things there. And conversely, potentially much more affluent communities are dealing with it regardless of the mask mandate. So I think a caveat, because I've looked at this exact same data, is trying to control for those differences in communities that may have an influence on rates. So yes, Carrie, and then Shuang. Okay.
And thank you, Ade, for pulling that data. And Rick, I agree. There's some variance in those communities. They're not all necessarily apples to apples. But I think another piece that's a question mark for me is that with the availability of the over-the-counter testing tools, the reliability, and I don't know, but I know this is a factor in terms to how many cases are getting reported or are not getting reported because folks are testing positive at home, but not choosing to share that information. I know that anecdotally that definitely happens. So it's just kind of the noise in the data. But it's very helpful to have that, nonetheless, to have that kind of the piece.
Yeah, no, the data is very helpful to look at.
Yes. Thank you.
Shuang, did you have a comment?
Yes, thank you, Dr. Lopez. Yes, like Ade's data showing some towns have mask mandate, but some not. And without a statewide mask mandate requirement, I just have a concern, like people can go to another town shopping and then they still live in Reading. So it's kind of hard to control the risk. So I just have this concern and want to raise up. Thank you.
Yeah, that's true.
Right. They go to another community where there's less stringent masking and they are exposed, and then they come back to our community and expose others potentially. Yeah, thank you, Sean.
I've also heard the argument, as actually Elise sort of alluded to it, which is, you know, I can't have a snack at the Pleasant Street Center, but I can go across to Christopher's and have breakfast, and everybody has their mask down, right? But I guess, you know, from a critical thinking point of view, there's a spectrum of risk and benefit. And sure, we could, you know, if you're really risk intolerant, we can go to lockdowns like we did a year ago or a year and a half ago. I don't think anybody's proposing that. But, you know, there's still a space in between where maybe you can do something that might have some improvement or some effect. I think that, you know, I want to raise this question. Our next meeting is January 6th. And I'm wondering what people feel, what board members feel about whether we should reconsider this at that board meeting, or do people feel there's more of an urgency that we should consider having a meeting just on this topic before January 6th, you know, conceivably Thursday or next Monday? You know, it's a significant decision, and I think there needs to be enough time for the public to be aware of us considering it. On the other hand, you hate to wait, I don't know, 10 more days to be able to make a decision when things are skyrocketing, and there will be a post holiday surge undoubtedly over the next 2 or 3 weeks. So thoughts about an earlier meeting before January 6th?
I would agree with you.
Same.
Okay.
Can I ask a question?
Sure.
So then how does this get out there so that more people are aware that this is on the agenda? And because I'm sure a lot of people are going to be concerned about it, because especially given the data that the gentleman was quite kind enough earlier to reveal, the numbers don't actually sound that different, and certainly not grand enough to take away the right to not wear a mask. And whereas maybe there's some efficacy to it, it also limits your oxygen intake, which is not a healthy thing. And you're rebreathing carbon dioxide. So with the small difference that maybe Winchester had, is that outweighed by the benefit of wearing a mask versus everything else we'd be giving up? Is what I just think. I think more people are going to want to be part of this, particularly business owners.
Right. Paula, did you want to make?
Well, I was just going to suggest to Narcissa, or ask where she got her data regarding the oxygen and carbon monoxide, because the data I read contradicts that.
I can send it to you.
I think it would. I think the way this gets out, as I understand it, is either from us posting it on the agenda, and you know, potentially for people who track that and monitor that, then they're aware that it will be discussed, and not infrequently the media, you know, will become aware of it and publish it, and then. And obviously, there would need to be time at such a meeting for public comment.
Okay. Thank you.
Just a quick comment.
Sure.
Lisa, if you have anything to send to the Board of Health, you can always send it to me. and I'll make sure it gets to the Board of Health.
Okay. Thank you.
So let me ask, what would make sense in terms of a somewhat earlier meeting just to talk about this topic? It could conceivably be, it has to be at least 48 hours in order to meet the open meeting law, but we are going into the end of the week. There's New Year's, so it could either be potentially Thursday or it could be a week from today, which would be January 3rd. I would ask Paula and Carrie, are you available either of those days, and do you have thoughts about what might be preferable?
I'm available either day.
Carrie, are you available either day?
Uh,
I think you're
available, sorry.
your screen is frozen and we're not getting great audio.
Can you hear me?
Just barely. Are either days fine with you?
Yes. Yes.
Okay. So, Bob, do you have any wisdom in terms of what might be the best appropriate action in terms of a date? Do you think a week is adequate time for this kind of discussion?
I don't see any conflicting meetings that are yet posted, which could be important. Generally speaking, if you're going to make a community-wide decision, a week's notice is better than 2 or 3 days. Just to get the information out there. Whether people care, whether they'll come or participate, I couldn't say. But if there's no urgent health reason to choose between Thursday and Monday, I think you're safer Monday in terms of just getting the information out there.
Okay. So why don't we plan to have a meeting on Monday, January 3rd at 7 p.m. For the express purpose of discussing a mask mandate in the town. And hopefully we can all give it a lot more serious thought and look at the data ourselves and get the word out, hear what the public has to say, and businesses and so forth, and make a decision going forward.
Sounds good.
All right.
Yes, that sounds good. Can I just add one thing, Rick?
Sure.
I very much value public participation, and I very much, I'm interested in the feedback from businesses and the like, but I'm also very aware that public health sometimes needs to make difficult decisions that may not be popular, and that we're bound by protecting the health of the public and looking at what's available from the data and what is required by law. So I just feel like that's an important thing to add. That,
Good point.
Yeah, very good. Thank you, Carrie.
Thank you. That's a good point.
I just ask a quick administrative question about the
Sure.
public comment meeting. If public comment is on the agenda, does everyone need to write to a day ahead of time to say that they're going to speak, or can they just show up?
What I would say is, and what's on our website, is that it's preferable to write to a day to let you know. You actually don't have to write a statement. You could just let him know that you would like to speak, but that is not an absolute requirement. So if folks show up for a public comment and they didn't write to a day, we'll certainly hear them. We do have to think about some, in terms of the agenda planning, some limit of how much time we can have public comment, because conceivably it could go on for hours. But so in response to your question, Rebecca, it would be nice just to give a heads up with an email, and I think that's what's on our website. But if anyone who came and if we can fit it into the time constraints, we would hear from them. And we usually try to limit the comments to 2 minutes. Okay, so if there are no further, yes.
I have a quick question.
Sure.
When does the mask mandate at the senior center take effect?
Good point.
Tonight.
Sounds good.
Yeah, it doesn't seem like there needs to be any advance warning unless, Kevin, there's, or at least there's some logistical issues around that.
We can make up a sign really quick.
Okay,
I got my glitter glue ready to go.
all right, we're good. Then it's effective immediately.
Thank you so much.
Yeah,
Is
thank
that-
you, Aday. Thank you to the entire board for your support. Really appreciate it.
Thank you.
Does that need to be part of the vote, though?
Yeah, yes. Well, I think because we didn't specify a start date, it would be assumed to be immediately. Is that?
Where's Kevin when you need him?
Bob taught Kevin everything he knows, I think, or I don't know, maybe they both learned together, right? What did you say, Bob?
You don't need to put a start date unless it's going to be delayed.
Yes.
Oh, okay.
Thank you.
Good to know. Thank you.
So make a motion to adjourn. Do I hear a second?
Second.
Second. Roll call, Paula,
Yes.
Carrie,
Yes.
and Rick. Yes.
See you next week.
See you next
See
Monday.
you Monday night.
Thank you very
Have a
much.
good
Night,
holiday.
everybody.
Happy-
Thank you.